Hello, welcome back to my channel. Dr. here. I'm a rheumatologist who practices holistic medicine in Hawaii. I also train resident doctors. One thing that I focus on everyone during the first appointment is diet. So-called Western diet is known to be harmful to our body. In general, the Western diet is filled with too much unhealthy fats, sugar, and artificial additives, which can lead to weight gain and many chronic diseases. They are high in calorie and makes us feel good, but it disrupts cellular function and triggers inflammation. Today, we want to talk about how poor Western diet and obesity can harm the body and contribute to diseases. The body stores excess nutrient as fat within adipose cells, fat cells. And adipose cells grow larger in size as they store more nutrients. In obesity, adipose cells can expand past oxygen supply capability of blood vessels. Adipose cells need oxygen to survive, and when they don't get the adequate oxygen supply, it undergoes cell death. This cell death triggers low-grade inflammation response. Dead adipose cells attract immune cells called macrophage. Macrophages act as cleanup crew. When they get to the area of cell death, macrophages secrete inflammatory signaling molecules such as TNF-alpha, IL-6 into the bloodstream to call more macrophages into the area and alert the entire body of the battle going on. In obesity, with persistent excess fat, this process doesn't cease, leading to chronic inflammation as macrophages cannot keep pace with the dying cells, maintaining a cycle of death and inflammation. In obesity, a continuous cycles of ischemia, cell death, and macrophage response, which includes TNF-alpha and IL-6 secretion, perpetuates chronic illnesses. Unless we change our lifestyle drastically and lose fat, this is what goes on in the body. In rheumatoid arthritis, we use medications to target TNF-alpha and IL-6 to reduce inflammation. TNF inhibitors tend to be less effective in obese patients because they produce more TNF-alpha compared to those with a normal weight. It doesn't end there. Obesity also contributes to development of diabetes and hyperlipidemia. As we mentioned, our body stores excess nutrient in our adipose cells. Our adipose cells have limits on nutrient storage capacity. Insulin is a hormone responsible for nutrient storage. When overwhelmed, they can become insulin resistant. When there's too much excess nutrients, the body says, I already have too much and I cannot store anymore. This resistance can lead to diabetes, characterized by high blood sugar, and contribute to hyperlipidemia, with fat molecules potentially clogging the blood vessels, raising the risk of cardiovascular events such as heart attack and stroke. In other words, since adipose cells cannot store excess nutrient anymore, sugar and fat are flowing through our blood vessels, causing trouble. The trio of obesity, diabetes, and high cholesterol is a potent mix for chronic inflammation and various diseases. Insulin resistance and chronic inflammation are at the core of most chronic diseases in the US. This is why diet is so important in chronic diseases such as rheumatoid arthritis. In the recent video on integrative approach to rheumatoid arthritis treatment, we discussed about anti-inflammatory diet and how it can help reduce the chronic inflammation. To recap, this is the version of anti-inflammatory diet that we discussed. 70% of your food should come from vegetable. We recommend at least 60 to 80 ounces of water per day. No processed food, no refined sugar. For more detail, please check out the video. Just to add one more information here, when people experience chronic mental and emotional stress, body makes stress hormone called cortisol. Cortisol upregulates appetite hormone called ghrelin, which makes us to eat more. There's a strong mind-body connection. This is why several of my videos concentrate on mindfulness practices to help people better deal with daily stress. I invite you to take a look at those videos if you suffer from chronic stress. I hope you enjoyed this video. Thank you.